Good morning. Welcome to the Save Our VA National Project Workshop. It's great to have you participating this morning and interested in this national campaign to save, fund, and expand the best healthcare available for American veterans. Quality healthcare they were promised and that they deserve. My name is Jeff Roy. I'm the coordinator of the Save Our VA National Campaign, or SOVA. I'm a retired teacher, social worker, and longtime community organizer living in Minneapolis. I served in Vietnam as a Marine Corps radio operator in 1968-69. For those of you unfamiliar with the SOVA National Campaign, we expect you'll come away from this panel discussion with a clear sense of the issues underlying this multi-year fight to protect VA healthcare. And for those already familiar and hopefully active around this campaign in your local area, you'll find much to gain from the updates we'll share today. First, some housekeeping matters. There'll be a 15-minute Q&A session at the end of our panel presentation. Your microphone will be muted to eliminate background noise. Use the Q&A function only to ask questions. You can use chat for chatting between yourselves. So with the Q&A function, you can enter your questions whenever you want. The Q&A icon can be seen at the bottom of your screen if you're using a computer. Otherwise, if using a tablet, it's likely to be at the top of your screen. The Q&A site will be monitored. When there are similar questions, they'll be aggregated into, into one question. Please take a moment to locate that Q&A icon. The topic for today's workshop are the Asset and Infrastructure Review Commission, or AIR Commission, what it is, and why it's important. Updates on current congressional legislation and other issues. Finally, how you can personally help protect VA healthcare through your VFP chapter or in your local area if you're independent, and how you can help nationally persuade members of Congress to actively support SOVA. Before we introduce the panelists, I wanted to provide you with a brief history of SOVA since its inception. VFP's Save Our VA National Project was organized several years ago to seek justice for veterans by launching a campaign to stop privatization of VA healthcare and to lobby for improving, fully funding, and staffing the Veterans Health Administration. In 2014, the VFP National Office had sent out an email saying that various forces were trying to privatize the VA. VFP members like Buzz Davis, Don McKeating, Will Williams, and others in Wisconsin responded and started calling for action. They held a press conference in Madison and succeeded in getting TV stations to cover the event. Buzz and his team then set up a national VFP Save Our VA working group after fellow VFP member Paul Cox suggested it. Buzz's SOVA working group then got a large grant, which was spent on SOVA banners and bumper stickers for national distribution to the many local Save Our VA action teams that Buzz and others had organized and encouraged throughout the country in 27 states. The SOVA local activities that followed this organizing work were often in collaboration with our allies in the VA unions, like the American Federation of Government Employees, the National Nurses United, and also with the Veterans Healthcare Policy Institute in San Francisco. Grounded on this great work and the development of local action teams and supporters across the country, the first SOVA National Lobbying Conference was organized and held in Washington, D.C. in February of 2020. through the efforts of Skip Delano, Liz Wiesen, and several other SOVA activists. The Washington Conference greatly improved the National SOVA Working Group's organizational cohesiveness by bringing together SOVA activists for their first national face-to-face discussion and for the planning opportunity provided to make the SOVA campaign an even more effective and robust movement. Eventually, in late 2020, the Save Our VA Working Group became the Save Our VA National Project with a new 6-member leadership steering committee. Our lobbying efforts during the Washington Conference allowed SOVA activists to develop lobbying skills and experience most had never had before, to meet with nearly every member seated on the House Committee on Veterans Affairs or their staff, to deepen the working relationship between each of these congressional staff and ourselves, relationships that would prove essential to our effectiveness once we left Washington. And finally, again, out of that conference, a new 6-member National SOVA Steering Committee was eventually formed. On that note, I want to encourage those of you attending today to attend or support the planned second SOVA lobbying conference in Washington, D.C. to be held February 13th through the 17th, 2022. Information will be posted in the near future on our webpage on the VFP site. What has SOVA done since the 2020 conference? SOVA has contacted VFP chapters throughout the nation to reactivate or establish new local SOVA action committees and maintain a network of these SOVA groups and supporters. We've supported them where possible by offering and conducting educational sessions through Zoom meetings or short presentations with VFP chapters. We've sent out call to action alerts or CTAs to these SOVA groups and supporters each month about critical congressional legislation that needs their support or opposition. And included with these alerts, a sample letter that SOVA activists can personalize and send to Congress in order to educate, influence, and pressure its members to support or oppose specific legislation. And finally, SOVA has posted, continues to, analyses and articles created by our collaborative partners at the Veterans Healthcare Policy Institute on critical congressional legislation and issues. That has been a lot for a small national steering committee to accomplish. With that said, I'll introduce our panel today, who are all members of the Save Our VA National Project Steering Committee. First of all, Bruce Carruthers is a U.S. Army veteran who served in Vietnam 1967-68 and is also a retired longtime VA employee. He recently testified before the House Veterans Affairs Committee on behalf of SOVA regarding VA-related legislation. Arliss Harum served in the Army Nurse Corps from 1970 to 75, including a tour in Vietnam. The majority of the rest of her nursing career has been overseas, where she served in Peace Corps police, worked in Cambodian refugee camps in Thailand, and ended her career in Cambodia, spending 20 years with a local NGO, providing home care for those dying at home of AIDS. And finally, Suzanne Gordon, who is a journalist and the author of several books, including Wounds of War, How the VA Delivers, How the VA Delivers Health, Healing, and Hope, and the Battle for Veterans Healthcare. And she's also Senior Policy Analyst at the Veterans Healthcare Policy Institute. With that said, I'll turn today's presentation over to Bruce Carruthers. Bruce, are you there?
I'm here. It just took me a minute to figure out how to unmute myself. Thanks,
That's
Jeff, and
okay.
I want to welcome everyone to our workshop on Save Our VA. And so we need my first slide up if we can. Okay, the next slide is. But my topic today is the Air Commission and why it's important to veterans, why we need to be concerned about that. But next slide, please. Before I start talking about the Air Commission, I want to talk about the Veterans Health Administration's 4 missions as a way to explain to people how important the VA is, not only to veterans, but to the nation as a whole. It's a review for some of us, it may be new information. The first of the 4 missions is healthcare. And should be the next slide. Okay, healthcare. This is the most obvious of its missions, but I'm not sure people understand the extent of it. The VA runs 146 hospitals, 120 residential rehabilitation programs, 134 nursing homes, 300 vet centers, 83 mobile vet centers, 783 community-based outpatient clinics, and in 2020, it treated over 7 million patients. So it is the largest integrated healthcare system in the nation. Research is its second mission. I'll give you just a sample of, let's do education since that showed up next. Education, the VA has teaching partnerships with over 1,800 educational institutions in this country. Annually, it trains 62,000 medical students and residents, 23,000 nursing students, 33,000 other health-related professionals, healthcare-related professionals, and over 70% of all physicians receive at least some of their training in VA medical centers. So many people in the public and some veterans don't appreciate how integral the VA healthcare system is to the nation's healthcare system. If it disappeared, the training and of many healthcare professionals would suffer. Next is research. A sampling of the kind of research initiatives that VHA is involved in include prosthetic, orthopedic, and sensory aid research for disabled veterans, including amputees, paraplegics, and the blind. And I want to mention here that the VA Blind Rehabilitation Program is one of the premier programs in the country. People who go through the VA's blind rehab program generally do much better than people who go through private blind rehabilitation programs. Toxic exposure to Agent Orange and burn pits, issues related to women, to sexual trauma, military service and reproduction issues, spinal cord injuries, traumatic brain injuries, depression and suicide. And that's just a few of the things that the VA research program is involved in. Last is national preparedness. The VA is a backup system in the case of emergencies, national emergencies to the overall healthcare system of the nation. And perhaps its response to COVID-18 is a good example. The VA provided nearly 1 million pieces of personal protective equipment during the pandemic, provided treatment for non-VA patients on an emergency basis, nearly 500 people. It sent personnel to non-VA and VA facilities when they had shortages, and that occurred nearly 5,000 times during the pandemic. That gives you a general idea of I think the strength and the breadth of the VA healthcare system. But on to the main topic, what is the Air Commission and why is it important? The question is, what is the charge of the Air Commission, which stands for the Asset Infrastructure Review Commission? The VA is to determine criteria to understand or to recommend which VA facilities will be modernized, expanded, realigned, reduced, or potentially closed. So this is similar to the BRAC Commission. If you recall that some years ago, there was a base realignment and closure commission that resulted in the closure of a number of bases. Perhaps the most infamous one was Homestead Air Base in Florida, which virtually destroyed a community once it was closed. So it is essentially the same sort of process as the BRAC Commission, if you recall that. The Air Commission is required by Title II of the Mission Act, and the Mission Act stands for VA maintaining internal systems and strengthening integrated outside networks. What is supposed to happen is that a 9-member panel is supposed to be selected by the President in consultation with leadership of the House and the Senate and chartered veteran service organizations. To date, as far as we know, these people have not been, names have not been submitted to Congress, although this was initially due by May 31st of this year. We have several issues with the membership of, potential membership of this community. And let me review these. First is that there's no requirement that the chair, the members of the commission, or the staff be vetted to ensure they have no financial or other connections with the healthcare industry that represents a conflict of interest. Second, one seat is to be selected to reflect current demographics of veterans. The issue we have with this is the current demographics tend to be white, older veterans, and there's nothing in the legislation that requires that current veterans are reflected, veterans and current active duty military, that tend to be much more diverse in terms of race, ethnicity, and gender. So unless these people are included, the Air Commission won't have a member that reflects not only current but future veterans who will use VHA services. One seat is to be reserved for a person who has experience in a private integrated healthcare system with a gross annual income of at least $50 million. There are two issues here. Outside the VA, there is truly no integrated healthcare system in the United States. Second, any individual who is a member of a corporation that earns at least $500 or $50 million a year will have a vested interest in having money from VHA deferred to the private sector. There are billions of dollars at stake here. So it is like saying, it's like putting the fox in the hen house to have somebody who has such an interest in the private sector. Next, there's no requirement that individuals who serve on this commission have direct healthcare experience, that is, they're healthcare providers, that they have public health experience, and the VA is a public health institution, or that they have any experience in managing VHA facilities. So there's no requirement that people provide care, that they understand public health care, or that they have worked in VHA. 3 members are supposed to be representatives of veteran service organizations. And the questions we have about this, and we did raise these issues with various people on congressional staff. Will these people be representative of current and future veterans? That is, the diversity of veterans that we now see. Do they use VHA services? That is, are they enrolled? Are they treated by VHA providers to understand how VHA works? Have they expressed opinions on privatization? Are they neutral, at least neutral on this topic? Or have they already expressed that they're in favor of privatization? Do they have links to the private sector, the private healthcare corporation? Last, there is no requirement that any member of the commission be an expert on hospital closings and physician and other healthcare provider shortages. Since 2005, 176 rural hospitals have closed, and during that time, 100 of them closed between January 2013 and February of 2020. And it is predicted there will be nationwide physician shortages by the year 2030. So what the commission has to consider, if they're recommending closing facilities, are they recommending closing facilities where there will be no alternatives in terms of hospitalization or providers? And somebody needs to be on the commission who can advise them of what the impact of closing or reducing the function of the facility will be. Right, next, we should be now on a slide that says Air Commission process. What is the Air Commission process? There should be here, yes, there are a number of dates that will be listed here on this timeline for the Air Commission. I'm not going to talk about all of them. You can look at them. I'm only going to try to review the highlights. There's too many to go over and too much detail. Right, certain things have been completed already, and I want to review them first. What has been completed is that the VA published in the Federal Register a list of draft criteria that it wanted people to comment on, and there was a 90-day comment period. And SOBA did comment on that. Some chapters commented on these, and individuals commented on these. The next thing that happened is the VA conducted listening sessions. And we participated in a number of these listening sessions, and I imagine a number of people in the room participated in them. These listening, then the future schedule is in 2022 or next year, the VA sends its recommendation to the Air Commission, and the Air Commission will hold public hearings so the public can comment on what the draft criteria are. In 2023, from January to May, the Air Commission will approve, modify, or reject the VA recommendations. So assuming that the Air Commission approves or modifies these recommendations, they send these to the President, and the President has the option to either approve or disapprove these recommendations. If he approves them, then in the years 2024 to 2025, the VA is to develop implementation plans. And under legislation, Congress is supposed to provide the funding necessary to implement these plans. On March 1st of 2026, the VA has to begin implementation of the Air Commission's recommendations. And remember, those recommendations are to realign, to change the mission, potentially close or reduce the function of VA facilities throughout the country. So what are the recommendations? What are the issues we have with the Air Commission? First is the final recommendations that were published for the Air Commission standards are very vague.
Are there mice?
If you look at them, or if you haven't yet, or if you take a look at them, and the link is on here, you can go to them and you can look at them and you can look at the comments that were made. We don't require a cost comparison between providing care in the private sector and providing care in VHA facilities. And there's more than one study that shows that the VA provides equal or better care in a more cost effectively. Second, they refer to the VA as the coordinator of care rather than the provider of care. And if you receive your service from the VA, this is alarming. We don't want the VA to become an insurance company. Under cost effectiveness, these standards are very vague, and they don't explicitly include quality as a primary factor in gauging effectiveness. Cost is only one factor. If you can get cheaper health care, but it's of lower quality, it doesn't benefit veterans. The second issue we have with the listening sessions, and if you attended any of these sessions, I think you'll appreciate it the way we did. They were poorly conceived and implemented. The questions were very general and very vague. There was no attempt to determine if the people who attended the listening commissions were veterans or, in fact, if they used VHA services. It was kind of everyone to log on could, and they could express their opinions. There was no attempt here to gain a representative sample of people who used VHA services and determine their satisfaction with VA services, their recommendations for improvements, and how they felt about privatization. In fact, SOVA wrote a letter to the Secretary of Veterans Affairs expressing our opinion that these should have been focus groups with representative sample of veterans so the VA could really understand how veterans feel about VA care, because surveys show that 90% of veterans are satisfied with the care they received there. So there was no representative sample. And what happened if you attended these often turned into a sort of bitch session where people complained about their personal issues with the VA rather than talking about global issues of VA care, where it should be provided and how it should be provided. Then there were supposed to be market assessments, and as far as we know, these have been conducted, but we were not able to determine what the criteria was and what they found out. So the issues we have here, when a market assessment is being done of a VA facility or other uses being considered, for example, is the fact that people who have what's called bad paper, that is less than honorable discharges, are we considering having them receive VA services? Are there veterans in that area who should be receiving services from the VA? Is it possible these facilities could have a joint mission with other federal healthcare initiatives, the Bureau of Indian Affairs, public healthcare initiatives? Or are we simply looking at who uses them and whether the facility is underused or not? Could it be converted to other uses? Okay, so then we get to why is the Air Commission important to veterans? If we have the next slide. It is important because this is an up or down vote. This is not a matter of the president having discretion on what part he approves or doesn't approve. So if the Air Commission makes recommendations that will harm veterans nationwide or harm you if you live in a particular area, for example, it recommends that your facility is closed or substantially reduced, and the president approves these recommendations, there's nothing that can be done about it, just as it was with the BRAC Commission. Secondly, the recommendation could change the very nature of veterans' health care, including so many things. For example, including research on Agent Orange toxic exposure. If the VA didn't do research on Agent Orange, if it didn't have the Agent Orange registry, if it didn't track effects of Agent Orange, I have a service connection based on exposure to Agent Orange, as many of us did, that would never be known. And all the difficulties that people are facing now from toxic exposure, from traumatic brain injuries, from sexual trauma, there will be no entity that will research these things that will be sure that veterans receive the care and the compensation that they receive. And last, perhaps most important, veterans will lose the VHA's whole health, whole person approach. If you've received care from the private sector, you have a good idea what it's like. You have to manage your own care. You see your primary care provider, he or she refers you to a specialist. You have to make sure the records are transferred back and forth. You have to schedule your own appointments. You're on your own. You have no idea how good that person. In the VHA, you have what Suzanne Gordon refers to as concierge service. You have a primary care provider who provides for you and who has your medical record, has all of your records, and treats you as a whole person. That will be lost. You'll be stuck in the system that everybody else is, which is just kind of fend for yourself. And if you want to know what that's like, you can read a book called American Sickness that details what the private care system is like. Finally here, many veterans do not recognize the extreme threat that the Mission Act and the Air Commission poses to the VHA healthcare system. If enough of VHA is privatized, we'll lose it and we'll never get it back. And so for us and for future veterans, the one entity that serves us and takes care of us and is concerned about our issues will be lost. So you may have questions about what you can do to stop this. And at the end of the session, we'll go over what sort of things we're doing and make recommendations to what you might be able to do to help stop this privatization. With that, I really thank you for your time and attention. I'll turn it back to Jeff.
Hey, Jeff, you're still muted.
All right. I'd like to call on Suzanne Gordon from the Veterans Healthcare Policy Institute to continue this conversation. Suzanne?
Thank you. Can you see me?
Yeah.
Okay, thank you so much. I'm really privileged. I'm not a veteran. I'm a healthcare journalist and researcher, and I was the co-founder and I am senior policy analyst at the Veterans Healthcare Policy Institute. And I'm privileged to be a member with these wonderful people on the SOVA steering committee. Could I have the next slide? So I want to look, I mean, Bruce has really gone over why the VA is so important, the VHA. I'm not a veteran. I have Cadillac Healthcare because fortunately my husband worked for the Communications Workers Union for 27 years. So I got healthcare from him because as a journalist in our crazy healthcare disarrangement in America, I hesitate to call it a system, because that suggests that it is. I wouldn't have been able to afford healthcare, and I really, with really the best healthcare, so-called best healthcare insurance in the country, and with a lot of knowledge myself, being a researcher in healthcare, I will never get the kind of care that many of my friends who are veterans get. And my husband won't either. The other day, he was trying to get an appointment with a specialist, and he was told to wait 5 months. And he sort of said to me jokingly, maybe I should have, enlisted in the Vietnam War instead of protesting it. Because he would have gotten in to see this specialist in 2 weeks in the VA, where it was 3 to 6 months in the private sector. So I think it's just worth repeating that, particularly that the VA has completely different incentives than drive the private sector. It is mission driven, not profit driven. And it's that means that there are very different imperatives that govern the kind of care veterans get, and the kind of the fact that it is a system and not just a kind of providing episodic care on a fee-for-service basis. Could I have the next slide? And Jeff mentioned, it does teaching, research, but I want to also talk about the fact that the American healthcare system in general does really badly in areas that are of critical importance to most of us and veterans. The mental health system in the United States is largely prisons and jails. In the VA has probably one of the best mental health systems in the country. In America, there's 7,600 geriatricians to take care of 30 million senior citizens, elders like myself. And the VA practically invented geriatric care. In fact, there are special geriatric primary care clinics in the VA. Primary care is central to the VA. We have a shortage of 45,000 primary care physicians in this country, and it's only going to get worse. In the VA, you have primary care done by a team. You have a nurse, you have a licensed practical nurse, you have a clerk, you have a physician or an NP, you have residents, et cetera, and they all work together in a team. Teamwork is central to the VA. And we know that of about 250,000 to 440,000 preventable deaths due to preventable medical errors in this country, the vast majority, over 80%, are due to failures in teamwork. And the VA really pioneers teamwork. Not only that, but the VA has primary care and mental health care basically integrated into primary care clinics in most places. So if a veteran says, I'm feeling anxious or depressed, they don't say, okay, make an appointment with a primary care, with a mental health professional out there. Usually the patient won't do it or won't show up. The primary care doctor or a nurse practitioner will walk the patient down in the VA to meet a mental health professional and get them started. And it means that you actually get care. The VA has much better staffed and run nursing homes. And what's really interesting is that there are way fewer healthcare disparities in the VA. There were way fewer disparities in deaths during COVID. And one study, for example, showed that African-American patients with certain heart diseases had fared better than in Caucasians in the VA because they had access to care and they had access to good care. Could I have the next slide? Next slide. This VA advantage, it's probably the term advantage in healthcare. It's kind of like the word Trump, it's been ruined by Medicare Advantage. But a recent study by Stanford economists showed that when veterans who were dual eligible for Medicare, so they could go to a private sector hospital or to a VA hospital, were taken randomly by an ambulance driver during an emergency, that the veterans who went to private sector hospitals were 2 times more likely to die in that private sector hospital during the 28 days following their visit than veterans who went to the VA. And also the cost for that failed care was 21% higher. Why do veterans have a better chance of making it out of a VA ER? That's because there's coordinated care. I mean, the issue isn't just what happens when you're in your doctor's office or in the ER. The issue is whether people coordinate care, whether care is coordinated. And we did in the Veterans Healthcare Policy Institute, we did several blogs on this to explain exactly on the ground why and how they coordinate care in the VA. So this is a very important study. It was actually the first study that compared veterans to veterans as opposed to veterans to private sector patients. Could I have the next slide? When we do compare private sector veterans to private sector patients, we find that the VA does better with people who have heart failure and heart attacks and pneumonia. It's a bright star in the constellation of safety practice, and its behavioral health programs are largely unrivaled. Could I have the next slide? And again, why? It's because all VA staff are on salary. They have no incentive to undertreat or overtreat. They have a lifetime responsibility for patients. You know, it's a system that deals with patients from discharge to death. So there's more preventative care and health maintenance. And remember, preventative care isn't screenings. You know, it's not PSA tests and mammograms and things like that. Preventative care is sitting with a patient for an hour or two to talk to them about how they can change their lifestyle, how they can drink less, how they can smoke less, how they can eat better, how they can exercise more. And also, you know, the VA does all this research because it has a huge patient population that's consistent over time. And finally, you know, and this I really notice as a person who's in the private sector, the VA is a community of care. I mean, you go into a private sector waiting room for your doctor or even in a cafeteria, people don't talk to each other. In VAs, veterans have communities. They have a huge program of peer support. They have peer support groups for Vietnam veterans, et cetera. So it's a very different kind of system. And I know many vets who think that the grass is greener in the private sector, and it's really not. I mean, just take women veterans. Women veterans represent 7% of the VA patient population, 7%. Yet for 7% of its patients, the VA has created a system of women's health, special women's health clinics, sometimes, you know, away from male veterans, who it turns out tend to be the biggest harassers of female patients. No private sector system would set up a separate healthcare system for 7% of its patients. And in the private sector, women veterans represent probably point-something% of patients. Could I have the next slide? Next slide, please. Next slide, sorry. Doesn't seem to be advancing. I can't control it. Does anybody have any ideas?
We'll try to get it up in a sec here.
Okay, so let me continue because I'm not sure. I didn't put it up on my own screen, so I can't really see it. You know, this system is now under threat. Let me see. Sorry, the system is now okay. So that was where we've stuck, and we need to. Okay, let's just go over that. Could we skip that, please? So we saw the advantages of the VA during the pandemic because the VA is not fee for service. it was able to cancel all in-person appointments immediately and switch to telehealth because it's a leader in global telehealth. And it canceled in-person appointments because it didn't lose any revenue. It transformed ICUs and other patients' wards to COVID wards, canceled elective surgeries and procedures, acted to protect nursing home patients, so you never had the kind of outbreaks in VA nursing homes. Could I have the next slide? Shifted staff. Right now, for example, staff in New Orleans that where in Missouri and other places that are being inundated by Delta, the VA is welcoming patients into their facilities. And as I said, and this is really crucial, throughout the American healthcare system, we've seen huge disparities in deaths due to COVID with African-American and people of color, and there is no disparities in the VA. Could we have the next slide? So what are the threats? All right, first came the Choice Act, then came the so-called Accountability Act that was going to make it easier to fire senior administrative staff, and ended up firing about 3,000, groundskeepers and kitchen workers and so forth. Then we had the Mission Act of 2018, which set up something that's called the Veterans Community Care Network, which I think of as the Veterans Corporate Care Network. And this dramatically accelerated the outsourcing of veterans to the private sector. And now, we have an extraordinary cannibalization of VA staff who are being moved from dealing with direct patient care or supporting direct patient care, psychiatrists, psychologists, nurse practitioners, who are being moved without being replaced to serve as insurance company gatekeepers, basically approving or rejecting referrals of veterans to the private sector. So think of it, if you're a vet and you want to get an appointment with a psychiatrist or a psychologist or really anyone, and you get delays. Why are there delays? Well, one reason is because that facility may have taken 25 nurse practitioners out of the game of delivering, or the mission of delivering direct care, and they're running around, Memphis, trying to get documentation from private sector providers. Or a facility could take 2 or 3 psychologists, each of whom sees 30 patients a week, and now they're supervising psychologists in the private sector. So that's 60 to 90 appointments a week that are not there for you, veterans, right? And they're sending people to the private sector without having any sense of the quality that those providers deliver, because the Mission Act specifically, Congress specifically, at the behest of private sector providers and the healthcare industry, refused to mandate that private sector providers abide by the same quality and wait time standards as the VA. We have the Commander Scott Hannon Act, which it sets up grants to send veterans who have mental health problems to the private sector, to grantees, and it's all done in the name of suicide prevention, but there's no requirement that these private sector providers have any track record in actually preventing suicide. This is like a huge scam, of directing taxpayer money to private sector providers without demanding any accountability, any transparency, or any quality. There is a total failure to study private sector capacity to handle veteran patients. I mean, what happens if 9 million veteran patients are sent into the private sector? And one of the problems with the Air Commission, as Bruce mentioned, is these market assessments did not study private sector capacity to handle veteran patients. In fact, they were so poorly executed that the VA secretary, the new VA secretary, Dennis McDonough, said in a hearing that by the time the Air Commission is actually sitting and evaluating what facilities to close, the data collected by by the market assessments will be so old as to essentially be useless and is so flawed that it really doesn't inform you of anything. Can I have the next slide? I think it's really important that we understand the problem that we're facing, and that is that there is a bipartisan coalition to outsource and privatize VA care. Now, if you asked any congressman or senator who voted for all these bills, like John Tester of Montana, Mark Takano, who is being better now under a Democrat than, frankly, he was under the Republicans. But if you ask any of the people who voted for Mission, who voted for Hannon, et cetera, if they are privatizers, they will say, oh, no, we're against privatization. And then they turn around and vote for privatizing bills. That's because they define privatization as basically the total sell-off overnight of the VA to the private sector. But privatization is a range of activities it's a kind of salami strategy. You know, you cut here, you attack there, you propose another bill here, and slowly but surely you shift money to the private sector, and you shift staff, and you create demoralization, and pretty soon your system fails. This is what has happened with the public schools and the charter schools. People are very familiar with that. So we at SOVA and VHPI encourage people not to talk about privatization and to go to legislators and to say, please sign on to be against VA privatization, because even the worst Republican privatizer will say he's against privatizations because vets don't like the P word. You have to say, stop the outsourcing, and begin insourcing care, fully funded staff. Could I have the next slide? So, Jeff talked about the Air Commission. I'm not going to go over that. If we could have the next slide. Okay, so here are some new threats. We have Senate Bill 1863, which was proposed by Jerry Moran. God, is he Georgia or Kansas? He's a Republican privatizer, very heavily funded by the Kochs. And basically, this bill, which has had some amendments, or not amendments, but changes of language, and is now going to the House, could be disastrous if it isn't changed further. Providers in the community won't have to publish their wait times on a publicly available website, as is required in the VA. And most importantly, the bill lacks teeth that will ensure that there are penalties, including contract cancellation to third-party administrators if they fail to meet access standards. Let me just say a word about these third-party administrators. The Mission Act set up this Veterans Community Care Network, and it hired Health, TriWest, and Optum insurance companies to set up the networks and sort of work, coordinate care with the VA. These Health TriWest with another insurer, HealthNet, was the TPA, the third-party administrator of choice. They had a terrible record under choice. There was all kind of fraud and abuse. They had to pay millions back to the government. So what is the Republican solution, or the bipartisan privatization solution to their failures? Hire them again, only replace one with a different insurance company to administer the Mission Act. Let's give them something like 32 cents on every dollar. It's a huge boondoggle for the insurance industry, and they're doing less and less and shifting more of the burden on VA staff, as I mentioned. So this S1680, 1863, I mean, we at SOVA and VHPI will continue to give you alerts about how you should reach out to your political representatives, because it's going to be very important for the House Veterans Affairs Committee to really significantly change this bill. Could I have the next slide? And basically, it continues this stealth privatization where you're outsourcing care to doctors who have no experience with veteran-specific problems, driving staff from direct care, closing closing facilities, laying off staff. We're already seeing stealth closures, and the Air Commission hasn't even begun. For example, in Troy, New York, they're closing a community-based outpatient clinic. No attempt to see whether that clinic could be more, they could increase utilization by doing greater outreach, by bringing in veterans with other than honorable discharges, by bringing in veterans who have so-called higher incomes and no proven service-connected disability, thus their priority 7s and 8s in the eligibility priority list. No attempt to see if you could bring in civilians under the 4th mission. We have to insist that you cannot close a single VA facility service line, program, they call them service lines in the corporate healthcare world, that you shouldn't close a single VA program or facility if you don't go through the process of finding out how utilization could be expanded. This is particularly critical in rural areas, as Bruce made clear, because if you do this, there will be a huge impact. And, the right wing pitches privatization as choice. We just want to give veterans the same choices all Americans have. Well, the same choices all Americans have, they don't have choice. They go where their insurance company sends them. They go where their health plan system sends them. And so if veterans want the same choices and the same care that the rest of Americans has, veterans should really basically look into what kind of choices their family members have, their friends have, their communities have, because there really is no choice in the dictatorial American healthcare system that we have. And really let me just give you one illustration of how bad things have gotten with this quote unquote choice, and how having greater choice in the private sector, which is way more expensive and far less effective. And also it's got to be mentioned that private sector providers don't know very much about veterans. And these studies have shown between 2014 and 2017, when choice was passed, the revenue going to private sector healthcare increased by 59%, and the money going to in-house care increased by 9%. Between 2017 and 2021, it's increased, the revenue going to private sector care has increased by 223%, and to in-house care 12%. I mean, I kind of rest my case. Could I have the next slide? So we need to fight for better funding and staffing for the VA, for in-housing care, for expanding eligibility to all veterans, regardless of discharge status, income, or service-connected disability. And Veterans for Peace has a really important role to play in that, because you are all veterans in Veterans for Peace, or most of you, and the sad fact that veterans are often very hard on each other. I have talked with veterans who about letting people with other than honorable discharges into the VA, changing the eligibility requirements that bar them from VA care except under exceptional circumstances, and they have to go through a very complex process, and mostly they don't get in. And I've heard many veterans say, oh, those guys or women, I made it through without getting drunk, without coming late to formation, without being insubordinated, so they don't deserve it. Oh yeah, Ray, they might have PTSD or TBI, traumatic brain injury, or military sexual trauma, but they still made bad choices. So it's going to take a lot of education of the veteran community to help to get veterans not to oppose this. We have to make sure the Air Commission considers expansion options. We have to support, this is a very exciting news I have to bring to you. Takano's bill, HR 4673, Ensuring Veterans Smooth Transition Act, which would force the DOD to enroll every eligible veteran into the VA before they got out of the military. And that would be a super, super important thing. Could I have the next slide? So I want to thank you. I want to ask you to join us. I want to ask you to give us information about facility closures, about problems you have with the private sector, to write letters and op-eds, to let us interview you about how the VA serves you or the problems that you're having, and to join SOVA to be at least active, if not an activist. And thank you for listening to me.
Thank you, Suzanne. Excellent, excellent presentation. That should raise a lot of questions for people to be thinking about. At this point, I would like to turn the session over to Arliss Harem on what you can do to help in our effort to save the VA healthcare system. Arliss?
Jeff, Arliss is having real difficulties with her connection, so she asked me to take her section.
Bruce, you want to take that then?
Yeah, I will, unless Arliss can end, but she just called me a moment ago. So I want to talk about what we can do next. I want to mention two things first, though, just sort of support what Suzanne said. I worked for the VA for 30 years in 10 different facilities in human resources and in healthcare management. And that was in every part of the country but Southwest. And what I can say is not only does the VA provide great care, but its staff is dedicated. I never saw a person walk into a VA facility where the first person that saw them didn't say, "Can I help you? What do you need?" It is, it's a team. It is people who are dedicated to the mission of caring for veterans, and it is a place that provides care for veterans in a way you can't get anywhere else. So if you haven't used the VA care facility, I encourage you to do that. It's an unusual organization that gets a bad rap in the newspapers sometimes and in media, a rap that's not deserved, that in fact, countless studies show the opposite happens in VHA facilities. It provides the best care any place in the United States, and it's really a model for the kind of care everybody should get. And second, one of the things I tell people I think could happen to the VA if it's privatized, it'll be like Medicaid. And there'll only be a few doctors who will take VA patients because reimbursement rates will continue to go down. It won't be well funded. And veterans will be left on their own and hoping to find any doctor at all who will provide care for them. But I want to talk about what we can do to help. So could we have the next slide? And Arliss is going to talk about that. And I want to say Arliss really manages this for us and does an exceptional job. So I'm sorry she's not able to talk about it. But what we would like you to do, there are a number of things. The first thing is to go to our website. And I think can we have the next slide? There we go. Sign up on go to our website, veterans4peace.sova.org.sova, and go to there and sign up for our calls to action. Can we have the next? What the calls for action are is, we develop letters generally to people in Congress, but sometimes to administration officials on really important issues. And these letters will discuss the issue, and it's really an easy thing for you to do. We developed the letter, you can look at it. It was automatically sent to the right person. And in addition, we get information on how many people wrote and where they wrote from. So when we talk to congressional staff, Jeff Roy, for example, has developed some really good relationships with some of the congressional staff. When we talk to them, we know that 200 people have written about this issue, so that tells them that it's important. And it's an easy thing for you to do. If we can go to here or in the next website, but in the other one, you'll see there's a sample letter. You go to this, you can enter your name. Go back one, please. You can enter your name and you can click on the message to personalize it. And I want to say that personalizing the message is extremely important, and that's an easy thing to do. Next slide, please. So you can simply say in this, I'm a veteran, I get my care at the VA. I always say I'm a service-connected Vietnam veteran, or you can say I have family members who are a veteran, I support veterans. But the point is that if a letter is personalized, it carries considerably more weight than if it's not personalized. If you just send what considers to be kind of a rote letter that you haven't taken a personal interest in, it's not counted as heavily as if you just take the time to put a few words in there like, I'm Bruce Carruthers and I'm a Vietnam veteran. I'm Jeff Roy, I'm a Vietnam veteran. I'm Suzanne Gordon. I've been concerned about Veterans Affairs for several years. That makes a lot of difference. My uncle is a veteran. He gets good care at the VA. So you personalize that. And if you sign up for the CTAs, we send you a notice when one is available, and we ask you to take a look at it. If it's an issue you agree with, then to personalize that and to send it out. And it is an easy way that takes a few moments of your time whenever we send one out. We try to send them out on a pretty regular basis to send that letter to the appropriate congressman or senator. It doesn't take much of your time. It's a way for you to be active without having to take the time to be a true activist. Could we see the next slide? We know that members of Congress pay attention to numbers. They actually figure, they have a formula where if one person writes a letter, they figure there are a number of other people, a substantial number of other people who are interested in that issue. So the more calls for action or CTAs we get our membership to send in, the more effective our lobbying effort is. And we ask others to do this. Ask family, friends, other members of the VFP chapter, other members of veteran service organizations or allied groups that you're involved with who might be interested in veterans issues. Ask them to sign up for the CTAs. It only takes a few minutes. And in many ways, it's one of our most effective tools to influence Congress on these issues that I talked about a little bit about, but that Suzanne really talked about, like the last legislation he talked about. That's the kind of thing we'll write a CTA on, and it'll go into Congress, and Takano and other people will say, a lot of people, especially if we can get people from across the spectrum to write letters to him, Takano and his staff will say, this is an issue a lot of people in this country care about and we should pay attention to, but it won't take much of your time, and it will really be effective in helping us strengthen and fund the VA. We have the next slide. There are more ways to help. You can write op-ed letters to your local paper. And surprisingly, I think after the sports page, op-eds are the most frequently read thing in a newspaper. People really pay attention to them. And in fact, one of the things we found is that almost all congressional staff have somebody who follows op-eds in the local papers. So if you write an op-ed about an issue that's related to a veterans issue, somebody in the congressional staff is going to look at that and they're going to report back to the congressman or woman that this is an issue that has been written about. People read that and it influences them. So don't discount the importance of an op-ed. And if you write an op-ed and it's not accepted right away, don't worry about that. Keep submitting op-eds. What really happens is if you constantly submit op-eds, eventually they'll see your name and your letter will be published. We will publish sample op-eds or send them out, and you can use them, modify them to send to your local paper. You can spread the word, and if you're a member of a VFB chapter, you can host a virtual session. We've done several of these where Suzanne Gordon has made very effective presentations on what's required to try to stop privatization. There are a number of chapters that haven't sponsored those, and we really encourage you to think about that and get in touch with us, and we can set up a time to host a virtual session with you. Wear a SOVA t-shirt. We've developed new t-shirts that'll be on sale. If you're a veteran and you receive your care at a VHA facility, wear your t-shirt when you get care. Stay informed. You can look at our website. I encourage you very strongly to sign up for the Veterans Healthcare Policy Institute website. It is the one single source where you can find information on issues that are important to veterans and to veterans healthcare. And I think we've posted that the address in the chat, and if not, we'll do it again. It's a very informative website. And then last, meet your members of Congress. Make contact with them. I know during COVID it's difficult to do, but we've done that. You can have Zoom meetings with them. If you can meet the member of Congress, and if you can develop a relationship with the staff member or members who are concerned with Veterans Affairs, it makes a lot of difference. You develop a personal relationship with them. You can talk to them about these issues, and it could come that they'll actually ask you. We were able to testify before the House Veterans Affairs Committee because of a relationship that we developed, particularly that Jeff was able to develop with a relationship with Tucano staff. And so we were invited, which is unusual for a group as small as ours to be invited to actually testify before the House Veterans Affairs Committee. Next slide, please. If you are active in a chapter, see if you can get your chapter to form a SOVA committee or be the contact person, so that if we need to talk to you, if there's something we want to encourage you to do, you can bring it up at your chapter meetings. You can join our SOVA National Campaign Committee. We have several subcommittees, and we could use some assistance if you're interested, and you can commit the time available to you. We would like you can contact us about this. Jeff is our national coordinator, and generally he is the person to contact. He'll probably put his email address in the chat. And so you can see how you want to become involved to every extent that you can become involved. And lastly, we are planning our second lobbying conference in February, and we really encourage you to attend. I went to the first one, and it's really how I got involved in this. So it's not only a good experience in terms of trying to influence Congress on veterans issues. I think for all of us, it was a really emotional bonding thing. We were in close contact with people who are committed to the same thing, who are veterans, who share the way we view the world, have had the same experiences. So in addition to being good, it's also a good personal experience, the conference. So we will be providing more information on that, and we hope that many of you will attend. Next slide, please. So we really thank you for your attendance at this session, and we hope to see you in DC next year. If you can't attend, we hope you will provide support in other ways. We really hope that you'll register to receive our calls to action. That's a simple thing to do. And if you have questions or comments, we'd like to hear from you at the email address here, sovamail@yahoo.com. I really appreciate your attendance and your time, and I will turn this back now to Jeff. Jeff?
Thank you, Bruce. Do appreciate it. I was just looking at the chat room and Q&As and so forth, and it sounds like many of the things that have been shared today are being received by listeners as important information. We have several questions that I want to read and then ask one of our panelists to answer. The first one is from John F. And it is, I spoke to a non-veteran African American and asked if he was a vet. He said no, but his male family members were vets. He believes that all vets are used in experimental care and scripts. Asked if he believed it was a Black issue. He said no. How do you go out in the field and change the minds of those that believe this? Anyone on the panel like to take that?
I'll be happy to try.
Okay, go ahead.
I mean, I think it's a really difficult issue in the Black community, and also, you know, we see this around vaccinations. I think it's extremely difficult to address. I mean, if anybody has a magic solution, I'd love to hear it. I suppose probably the most effective way to address this would be to find an African-American patient who is a veteran who's at a VA and who has had a good experience to talk to that gentleman. But, you know, people's belief systems are very hard to shake. I mean, I think that another extremely difficult problem is that many veterans have listened to Fox News, and even veterans who are well cared for at one VA think that that VA is somehow an exception, and VA down the street or in the next state or county is not good. So I think probably the best way to deal with this is to have a lot of patience, to ask people about their views, and then to ask them permission if you can offer your own experience as a way of perhaps suggesting that there are alternative experiences that veterans have. I wouldn't get into an argument about it ever, because it doesn't get you anywhere. But it is a difficult question. And I think, as I said, the most important thing and the biggest problem is the feeling that vets have that because they've listened to Fox News, they've listened to NPR, they've listened to the New York Times, and they don't believe that the VA is a good system. People talk to me as a journalist. I'm not a veteran. And they ask me, what are you writing about? And I say, I'm writing about VA healthcare. And they say, oh, are you doing an expose? And my line is, yeah, I'm exposing what a great healthcare system it is.
Thanks, Suzanne. Do appreciate that.
Jeff,
Yes.
could I just hang on for a second?
Go ahead.
The other thing that could be done is the VA has many healthcare providers of color. And I think, I don't know how we could do that, but testimonials from VA providers about the quality of VA care might go a long way to resolving the problems. I understand the suspicion that many people have of healthcare in general. It's not just the VA, it's healthcare, and the VA is one element of that. But I think actually testimonials from the VA, and it's not that the VA doesn't have the same sort of issues with discrimination that other organizations do, but the VA has done much more to address that issue than other healthcare providers have. And so I think information from providers and what the VA has done to address these issues that other organizations haven't might be helpful in that regard.
Bruce, while we're talking about VA and care and so forth, could you answer a question that Pete offers up? And let me find his question here. Is it true that you can't use some aspects of the VA hospital based on your disability rating?
Well, there are priority things, and to get full care, for example, to get into a nursing home care unit, it'd be based on a priority because there's limited spaces. So it is true that based on your disability rating, on your priority rating, that you have access to some care, and whether you have to pay for your care or not depends on your rating and capacity. So one of the things that really would be better, and I would think that any veteran who served ought to be eligible for complete care, but right now, because of funding and priorities and congressional initiatives, it is true that there are some services that might not be available to you based not only on veteran status, but on your priority rating. So if you're 50% or above, then you're in a category where everything is available to you. But even if you're service connected and you're below that 50%, depending on your location in the country and the facility, it may not be available. So if I live in an area that in the Southeast, for example, or even the Southwest, where many veterans are moving, and funds haven't been shifted in that direction, well, then care is not available, as if I lived in the Northeast, for example, where it might be easier to get an appointment. And that's really two things. It's a matter of funding, and it's a matter of this priority system the VA has established based on funding. So adequate funds need to be available, and it's my position that anybody that's served, and Suzanne made the point well, I mean, so somebody has a less than honorable discharge. We have people who have served combat tours and got in trouble at sometime at the end of their enlistment. And it really depends. I mean, whether you get in trouble or not depends on who's your commanding officer, what's your branch of service, what happens right at that particular time. I could get in trouble and I could get an Article 15 and still get an honorable discharge or just get extra duty. I could be serving under a commander at a time where I get in trouble and I get a less than honorable discharge. It's not even at all. So anybody that served, completed their tour of duty, I think ought to be eligible for the same service that anybody else is. Whether you get an honorable or less than honorable discharge is often a very arbitrary decision.
That's a good point, Bruce, and thank you much. I want to shift to the next question. Suzanne, maybe you could cover this. Let me read the question here. It's from Sam. He's got two questions, but let me see here. How would you evaluate current VHA-sponsored research on psychological trauma and moral injury in particular?
Well, the VA has done really extraordinary work. I mean, I don't know that anybody else really even has a category of moral injury. I mean, the VA is really a trauma-based system. It does trauma-informed care, and it's one of the leaders through its National Centers for PTSD on trauma. I mean, people in the trauma world go to the VA for help, you know, like after 9/11, during COVID and so forth. I think their research is extraordinary. And of course, one of the things that will be lost if we privatize is research and access to lots of different people. And, you know, the private sector most private sector doctors don't even ask if you're a veteran, much less about your experience. So I think it's, you know, the research is better. Right now, there are attacks on VA teaching and research from inside the VA and outside. VHPI is doing a lot of research about the nature of these attacks, and they're trying to really create problems between the academic affiliates that the VA has affiliated with since 1946. Pretty much every large VA has an academic medical center associated with it. For example, San Francisco is University of California at San Francisco, and other facilities. And we don't want to let that go on, and we have to really fight that. So I don't know if Sam had another part of a question. I can't really see it.
I think I'm gonna, because of time, I'm gonna have to move on to another question.
No.
And let me see here. So,
Jeff, can I make one brief comment about what Suzanne said?
sure.
The affiliations saved the VA. The affiliations with medical schools, I worked at a couple. The last one was at the Denver VA Medical Center, and the VA is built on the same campus with that. So in VA physicians have joint appointments at the VA and at the medical school. So all the very high quality, cutting edge services that are available at medical schools, which also have research programs, are available to any veteran. A veteran comes and they need services. They also get it from the medical center. For Duke, for example, which is one of the best hospitals in the country, the VA facility is built right across the street from it. If we lose that, VAs will become like community hospitals. They won't be where you can go to a place and you get the very best care, cutting edge care, where research is done all the time. So I think Suzanne's point can't be emphasized anymore. What turned the VA apart from just a community care system to a modern healthcare system provides the best service is these affiliations with medical schools. They're extremely important to veterans care.
And can I just add to that also the VA teaches medical schools and doctors who do not do care coordination. I mean, a lot of the things that the VA does, the medical schools don't teach. They don't teach teamwork effectively. They have learned a lot about patient safety from the VA. They certainly learn about veterans from the VA. So if you eliminate opportunities for medical school residents, psychologists, and so forth to go into the VA, you will really hurt American medicine and American healthcare in many more ways. And one of the things they're attacking is the joint appointments. They're now claiming that these joint appointments are conflicts of interest as opposed to occasions for collaborations. I mean, this is a relentless attack on the right. They have endless energy. And I don't know, Jeff, if you've seen this, but there's an answer that I was trying to answer live, but I messed up. Jim Wogelmuth said he sometimes feel, were you going to use that?
I was just going to go into that. Let me read that question from Jim. And then, yes, if you will respond to it, Suzanne. Sometimes, Jim says, sometimes I feel we're fighting a losing fight. My blue dog Democrat, Jim Cooper, is not going to help forestall privatization, and the younger Congress people are not aware of the quality of the care we get. How can we get through to people who really don't care?
Well, I think that's a very good question, Jim, and I'm so glad you asked that. I mean, I think that, you know, we aren't, you know, in part, many of us feel we're fighting a losing battle, but I think part of our job, sometimes even when we don't win, we make things less worse. I mean, I think SOVA, and this is a tiny band of activists and advocates who really have, you know, we with VHPI and other groups have really put the privatization word on the map and explained what it is. And I think we've made them afraid of the P word. I think we have to make them care. I think, Jim, you said what the solution is, that they're ignorant. And, you know, if 10 veterans or even, I mean, imagine 50 veterans go to a particular legislator, they will start to pay attention. Now, maybe they won't listen, but sometimes they will. And we've had amazing luck in that regard. I think that we are making them listen. We have a big opportunity with Biden that we didn't have with Trump, and we need to take it. I mean, you know, my view is, okay, there's 4,000 members of Veterans for Peace. If we could just get 400, I'm happy with 40, you know? And so I think that it's a very depressing road sometimes, but I think that we are making headway. And the very fact that they invited a group called Veterans for Peace to speak at a hearing suggests that there is a little bit of headway being made. So I would encourage, you know, pessimism of the intellect, as Gramsci said, and optimism of the will.
Thank you, Suzanne. I think we have time for one more question that actually I saw in chat.
I'd like to add something to Suzanne there.
Say what? Is that you,
I'd
Arliss?
like to add this.
Yeah, you're
Yes.
breaking up, Arliss, but go ahead.
I'll try. Talked about member of Congress. It's not so hard to do. Be very glad to attending with you, but we need a constituent.
Arliss, you're breaking up so much it's hard to hear.
It's before you again in the chat room. I'm trying to say.
You want to send something?
I'll put it in the chat room.
Okay, I'll look for it.
Um,
Yeah.
um,
I got a message from Rick on the West Coast. Said, can you send us all lists of the bill numbers of various privatization bills? Each of us can do a little work to help create a record of how our member of commerce voted. This could help develop a list of who we need to target. I'd definitely be more motivated to arrange meetings with my member of Congress if I knew they needed to be educated. And I think, as I had said to Rick offline, I had said that we have some bills that we have the votes listed in terms of members of Congress on particular legislation. The problem is that we are a 5-member steering committee that is trying to run all of this. We need more help from those of you who are out there that have the interest and time to help us. We could use help with outreach. We could use help with, for instance, what Rick is talking about in terms of getting information about members of Congress and their votes and so forth. So if you have interest and time, doesn't have to be the only thing you do, but contact us at the email that's been provided, sovamail@yahoo.com, and let us know if you can help. You could be on one of these subcommittees, and again, doesn't have to be every waking hour. It doesn't have to be every week, but you could be of some assistance. So I appreciate you thinking about that.
Could I just hit that one, Jeff? I think that, there are lists of who voted for the Mission Act and so forth. But the thing is, and you could probably write off most Republicans, but I wouldn't write off Democrats even if they voted for the Mission Act or the Hannon Act, which many of them did. For example, Bernie Sanders voted for the Hannon Act. That was shocking, but he did. So I think the situation is dynamic. And even if they voted for some of these bills, many of them voted for choice. Choice turned out to be a nightmare because McCain screwed Sanders. So it's a very dynamic situation. And I think that, even if they did vote for something that we don't like, you can help them understand how moving forward things are changing. And one of the big arguments you can use is that we have now COVID-19, and COVID-19 has thrown many veterans out of work. They've lost health insurance. Their families have lost health insurance. We were losing private sector providers. We're losing hospitals, as Bruce said. So, it doesn't matter what you did 10 years ago or even 3 years ago. What can you do moving forward? I think that's the argument.
Okay, well, thank you, Suzanne. And I think we're running almost out of time here. I want to thank all of you who have come to listen to what we have to say. I think there was like 42 of you, and I do appreciate that. And we all appreciate that, I should say. And again, use our website or web page to find out the information that you want to find out further. Use it to sign up for calls to action that we send out, bi-weekly, something like that, because that is very valuable. And I think with that.
Thank you.
Thanks everybody for attending.
Take care.
Take care.